The hearing will come to order, and good afternoon to everybody. We are here today to examine the global impact of nutrition and supplements during the first 1,000 days of life, a period from conception to roughly age 2, and how we can leverage U.S. taxpayer funds to achieve maximum results. As you know, this subcommittee has played a key role in advocating for an enhanced focus on food security. For the past 2 Congress, I've been working on authorizing legislation for our flagship nutrition and food security program, Feed the Future, and worked very closely with Dr. Shah before he left USAID on crafting that legislation. I authored the Global Food Security Act of 2015, H.R. 1567, which passed the House in April, as did its predecessor bill in the last Congress, thanks in large part to the leadership of Majority Leader Kevin McCarthy, who has a very personal and keen interest in ensuring that this legislation becomes law. Today's program also follows upon a hearing we did in the latter part of 2015 called Food Security and Nutrition Programs in Africa, which highlighted the role of a number of implementers, playing on the ground, as well as a hearing we held last Congress that we called the First 1,000 Days. For this afternoon's program, we will step back and take a look at the role played not only by the U.S. government, which has been pivotal, but also the United Nations. Thus, we will be hearing from USAID's Assistant to the Administrator, Dr. Beth Dunford, who will relay to us some remarkable results that USAID-led Feed the Future initiative has achieved in reducing stunting by emphasizing those first 1,000 days and the implication of those results for developing nations that are seeking to grow not only their human capital but also their economies. We'll also be briefed first by Ajay Markandi of the United Nations Food and Agricultural Organization. Part of our ability to leverage U.S. funds depends on our partners who play key roles in enhancing food security throughout the globe, and none is more important in this regard than the FAO. I want to highlight that in his statement, there's an underscored in a key point of this hearing. The rationale for supporting proper nutrition is not simply a moral imperative, but it's also economic. It has been long established that malnutrition undermines economic growth and perpetuates poverty. Indeed, there is perhaps no wiser investment that we could make, not only in the human person, but also in the economies of the developing world, than to concentrate on ensuring that sufficient nutrition and health assistance is given during those first 1,000 days of life. Children who do not receive adequate nutrition in utero are more likely to experience lifelong cognitive and physical deficiencies, due in particular to stunting. UNICEF estimates that 1 in 4 children worldwide are stunted due to a lack of adequate nutrition. The African Union Commission Cost of Hunger in Africa study estimated that the economic costs associated with child undernutrition are substantial, from 2% to 16% of the gross national product in several African nations. For instance, this cost was estimated at the United States in U.S. dollars, $4.7 billion in Ethiopia in 2000 alone, which is equivalent to 16% of Ethiopia's GNP. Conversely, by helping women throughout pregnancy receive adequate nutrition and supplemental micronutrients, such as iodine, vitamin A, and folic acid, and ensuring that they are well nourished while nursing, children and mothers thrive. To give one example, studies indicate that if we provide women of childbearing years with the recommended dose of folic acid during the 3 months prior to pregnancy and during the first month of pregnancy, the risk of autism spectrum disorder, or ASD, is reduced by a whopping 40%. We do look forward to hearing some of the results that USAID has been able to accomplish with regard to reducing stunting, again attributable to the Feed the Future program. It is also my hope that as we look now to the next administration, that we will be able to enshrine food security and nutrition as a firmly planted cornerstone of U.S. policy. Consider how President Bush, beginning in 2002, had the initial foresight to elevate the important role of food security in U.S. foreign policy, especially in Africa, via the Initiative to End Hunger in Africa, or the IEHA, which was funded through development assistance and implemented to USAID. At the same time, the Millennium Challenge Corporation began making substantial investments in agriculture-led economic growth programs, particularly in Africa. This is a policy course that President Obama has continued and built upon with the Feed the Future initiative instituted at the G8 meeting in Italy in 2009, when the countries of the world came together to ensure that we cultivate resiliency in food insecure countries so that they can withstand the next food crisis, such as we saw in 2007 to 2008, a crisis that Dr. Beth Dunford was on the front lines in battling. It is my hope and the committee's hope that the next administration, whomever the president may be, will build upon this and continue that focus. For by addressing nutrition during the first 1,000 days of life, we can help ensure that the next 25,000 days, or whatever the number our Creator has allotted for that individual, are filled with good health. I'd like to now yield to my good friend and colleague, Ranking Member Bass, for any opening comments.
Thank you, Mr. Chair. I also want to thank Mr. Markanday and Dr. Dunford for appearing before the committee this afternoon. And I look forward to hearing their perspective and testimony on what is one of the most important issues facing the developing and developed world. As I've said in the past, the U.S. has long been a leader in the realm of food aid internationally, and over the years has contributed consistently and innovatively regarding the global challenge. President Obama established the Bureau of Food Security in 2010, and by doing so, demonstrated the high priority that we place on addressing the issue of global food insecurity. This key decision by the Obama administration has led to greater coordination amongst government agencies and leveraged strategically government efforts to combat global hunger and food insecurity by not only working with recipient governments, but also with international organizations and other donors. Feed the Future stands out in this effort to combat some of the most challenging examples of food insecurity worldwide. I believe one of the reasons that the U.S. has led so effectively in this arena is the focus that the government places on strong partnerships with recipient countries. Also, the Feed the Future program has worked with not only host governments, but the private sector. And critically, local civil society, I believe this inclusive approach is the key to the initiative's effective implementation. Addressing food security challenges effectively also means addressing the challenges facing newborns in countries plagued with food insecurity. In this regard, I look forward to hearing the testimony of Dr. Dunford regarding progress and ongoing challenges regarding stunting. Of particular interest to me are identifying what approaches work successfully and whether success in one region of Africa, for example, can be duplicated in another region. Also, I would like to know what role capacity training has played in these efforts. I would also welcome statistical information regarding successes and challenges faced by countries in both Africa and Asia, and how our country, in concert with the host countries, the international communities, and donors can help address such challenges. Thank you.
Thank you very much, Ms. Bass. I'd like to now point out that pursuant to committee rules, we will suspend the hearing and convene an official briefing in its stead to receive expert testimony from Dr. Ache Markanday of the Food and Agriculture Organization. He is the director of the Liaison Office for North America and is an expert in sustainable agricultural development with over 35 years of experience in over 20 countries. Having served on a number of international development agencies, he is uniquely positioned and has a keen understanding of the importance of leveraging international organizations to further global development goals and initiatives. He has earned many accolades and commendations for his efforts in promoting global food and nutrition security, and most recently received and was recognized by the Prime Minister of Cambodia for his work on the country's global ag and food security program. Mr. Markanday, the floor is yours.
On behalf of Dr. Graziano de Silva, the Director General of the United Nations Food and Agriculture Organization, I would like to thank Chairman Royce, Chairman Smith, and Ranking Members Bass and Engel for the opportunity and honor to brief you this afternoon on the work of the FAO is undertaking to support the efforts of the United States in the fight against global hunger and malnutrition. I would also like to acknowledge USAID, an extremely valued partner of FAO, and especially Dr. Beth Dunford and Feed the Future team, who are staunch advocates for the principles of Chairman Smith's Global Food Security Act. Chairman Smith's contribution, passion, and unyielding drive in advancing the health and nutrition needs of children worldwide is at the core of what brings us here today. From the beginning, FAO has been inspired and supported by generous contributions from the people of the United States. The United States and FAO have an historic relationship, and the US was instrumental in its creation and leadership. In 1943, President Franklin Roosevelt convened 40 countries in Hot Springs, Virginia, to charter an international organization dedicated to global food, nutrition, and agriculture. So, Mr. Chairman and honorable members of the committee, FAO owes a tremendous debt of gratitude to your country's vision for a world free from hunger. To this day, America's vision remains at the heart of FAO's charter. Chairman Smith's Global Food Security Act and its significant bipartisan sponsorship further demonstrate US leadership where no child is left malnourished. I hope that the US further leverages the long-standing relationship and partnership with FAO in advancing the Act's worthy principles. As background, and to further underscore the significant relationship between the US and FAO, it is important to note that the US is not only the FAO's founding member country, but also our largest resource partner. The United States contributes the lion's share of the FAO core budget and is second only to the European Commission in voluntary contributions. In addition to significant financial contribution through USAID, USDA, and other US agencies, FAO receives valuable in-kind contributions from the US through scientific and technical expertise. US expertise has been instrumental in shaping key FAO policies and programs at the global and country levels. Major areas of cooperation include food and nutrition security, emergency assistance and resilience, food safety and sustainable agriculture production, and natural resource management. There is ample scope for expanding and deepening our collaboration in nutrition. And now I'll turn to the concerted efforts of FAO in the area of global nutrition in the first 1,000 days. Ending hunger, food insecurity, and malnutrition is our Director General's highest priority. In 2014, FAO co-hosted the second International Conference on Nutrition, where 170 countries made the noble commitment of reducing all forms of malnutrition under the Rome Declaration. Following the declaration, I am pleased that the United Nations General Assembly has unanimously endorsed the Decade of Action for Nutrition earlier this year. Supporting proper nutrition is not simply a moral imperative, but makes economic sense. Malnutrition undermines economic growth and perpetuates poverty. With productivity losses to the individual estimated at greater than 10% of lifetime earnings. To the economy, losses are high, and in Africa and Asia are estimated at over 11% per annum of GDP. Yet targeted investments in promoting nutrition, in providing micronutrients, and supporting community-based programs targeted at children ranks amongst the highest of all investments. Improving nutrition in the first 1,000 days must be backed by sustainable private-public partnerships. In this regard, FAO values the role of the private sector and recognizes its essential contribution to assure the nutritional quality and food safety, investment to infrastructure and storage, and improvements in supply chains. The private sector is our key ally under our private sector strategy. The first 1,000 days in a child's life are critical. Malnutrition leads to infection, stunted growth, resulting in poor physical and cognitive development, as Chairman Smith has just pointed out. However, malnutrition during this period can effectively be addressed through targeted investments in proper proteins and vitamins, and especially through diversified diets. FAO's unique comparative advantage and strength amongst development partners includes convening governments and other actors in sharing of information and best practices, developing more effective policy dialogue, development and dissemination of norms, standards, and guidelines, delivering technical assistance at the primary school as well as the university level. The key elements of FAO's comprehensive strategy on nutrition include increased knowledge and scientific exchange, diversified food systems, the importance of food intake and food safety, creating an enabling environment by mainstreaming those policies into national agricultural and investment plans. FAO has partnered with USAID in many spheres, especially under FANTA, to monitor programs, progress and outcomes, and has developed indicators. Additional collaborative efforts with USAID Feed the Future include field-based trials in countries like Bangladesh, in Cambodia, where I served, and Zambia. A good example is Bangladesh, where FAO leveraged financing from USAID to leverage other financing from the European Union. These activities are now being scaled up as part of the USAID FAO MUCH, Meeting the Undernutrition Challenge program, with mainstreaming this program into national food policy and country investment plans. FAO also works closely with USAID in support of the African Union's new partnership for Africa development in building capacities of 50 member states of the African Development Bank to mainstream nutrition and agriculture investment plans through CADP, National Capacity Development Initiative. Mr. Chairman and honorable members, in conclusion, FAO is an international organization and is at the service of its members. We are both an instrument of the collective policies and goals of our member governments. As I have noted, the United States is a leading member and partner of FAO. Our history is long-standing and your contribution is unmatched. The US should expect value and results from FAO to be a collaborative instrument in furthering the goals of the Global Food Security Act. We have 197 member countries and organizations, and offices and programs in 130 countries. Therefore, FAO can be strategically leveraged by the United States as a partner to collaborate directly with our members to achieve far-reaching positive goals, results, and progress. For example, the last World Food Summit hosted by the FAO brought together 5,000 delegates from 180 countries, including 60 heads of state. During this summit, $20 billion was pledged to end world hunger. FAO has the political neutrality and mandate to globally raise levels of nutrition and standards of living. And FAO can be instrumental in articulating and fostering your global health, nutrition goals, and initiatives. Chairman Smith, Ranking Member Bass, and members of the committee, recognizing that your oversight extends to international organization, I leave you with one final thought for your consideration. And for this, I'm removing my FAO cap and doffing my international civil servant cap. In addition to the FAO, I've worked with and within many international organizations globally. I cannot think of a single one that, like FAO, the United States does not contribute to generously and invest in generously. In fact, the United States of America usually invests to the vast majority of other countries. These international organizations to which the US belongs and invests can and should be effective and responsive instruments in promoting sound global policy, be it for health, nutrition, trade, economic, or wherever your priorities exist. For many countries that have limited national resources, they effectively use international organizations as vehicles to leverage their policy agenda and goals. I submit for your consideration that the US can be even more effective in your strategic engagement with these organizations in which you invest so substantially. Demand return on your investments. And on that note, I will now replace my FAO cap and pledge to this committee and the entire US government and citizens that as the Director of FAO for North America, you have my highest assurances that I will strive every day to deliver results and return on your investment on behalf of FAO. Once again, Chairman Smith and members of the committee, I thank you for the honor and privilege of briefing you today.
Mr. Mercanti, thank you for your excellent testimony, even more so your extraordinary leadership. And without objection, your full statement will be made a part of the record. I just want to say, I know that the rules preclude us asking a number of questions, but I would want to thank you for underscoring the importance of the Decade of Action on Nutrition. And it does coincide, I believe, very, very in a very good way, synergistic way with the post-2015 Sustainable Development Goals, but it is a matter of prioritization, particularly with the SDGs. There's so much in the SDG mandate that nutrition could easily get lost. So having that decade of action, having your leadership, of course, having Dr. Dunford's leadership and the leadership of the Feed the Future U.S. Initiative, hopefully we'll keep this front and center, because this is a winnable initiative. And every time we win, we collectively, the international community, women and children and families' lives are enhanced. And it can't be said enough, and Dr. Dunford makes the statement in her question, in her, 2011, 45% of child deaths, 3.1 million children were attributable to undernutrition. That is, in a way, a scandal that we haven't even done more to eviscerate that causation of death, which we could do, I believe. Thanks also for recognizing the generosity of the American public. We often get criticized that on a per capita basis we don't provide enough. Very often not on the ledger or airlift, what our military does, working side by side with USAID and NGOs. I myself and certainly Piero, we've been to the tsunami or the hurricane, the typhoon that took place in the Philippines. And the military was there working side by side, and if they were not there, many more lives have been lost. And there was the Abraham Lincoln, and a few years before that, when the tsunami hit Banda Aceh and other areas in that, they were there saving lives, and none of that ever gets calculated in terms of costs. So I do believe the American people are very generous, as are other countries, and we do, as you pointed out, we need to demand accountability. We do oversight. We need to do more of it, and I thank you for ensuring that your money that you are allotted from multiple sources is well spent on behalf of people. I'd like to yield to my friend, Ms. Bass. Okay, thank you. He wasn't expecting a question. Okay. Do you have any other comments you'd like to make? Because your testimony was excellent. And
Thank you very much, Chairman Smith. And I'm so happy that you've underscored a lot of the things that I did include into my briefing in terms of the decade of action on nutrition and how we should leverage more out of other international organizations. I think that's terribly important for results. I think the only point that I would like to make, that the FAO was, as I said, under the US leadership established in 1945. The world has changed. And we as an organization recognize that we have to be fit for purpose for the future and the challenges that are coming. So I think with your leadership, we are looking forward to being that type of an organization.
Thank you. And Mr. Burkendi, also, and you'll never have this problem, but compassion fatigue is a problem we have to be careful about. I'll never forget, after the first drought, man-made drought by Mengistu in Ethiopia, everybody was on board. We are the world. Everybody wanted to. When it hit the second time, it was like, been there, done that, got the T-shirt. People were not interested. It was horrible because people were dying. So again, you're part of the leadership that ensures that these individuals are never forgotten. And again, your emphasis, again, I think I might have said it, but on not just saving lives, but enhancing their ability to get a better education and to go on to raising more dollars by way of their capabilities for their families. It's a win-win-win all over the place. So thank you again for your leadership. Thank you. Mr. Clausen? Okay, thank you. We would like to now resume our congressional hearing, and again, thank Mr. Marcandi for his appearance here today and his insights. And I'd like to welcome to the witness table Dr. Beth Dunford, who is the assistant to the administrator in USAID's Bureau for Food Security, as well as deputy coordinator for development for Feed the Future, the U.S. government's Global Hunger and Food Security Initiative. In this dual role, Dr. Dunford coordinates implementation of Feed the Future across the U.S. government, a whole-of-government approach. It oversees its execution, reports on results, and leads engagement with the external community to ensure that food security remains high on the development agenda. Dr. Dunford also oversees USAID's technical and regional expertise focused on improving food security to sustainably reduce hunger, poverty, and undernutrition. A career Foreign Service officer, she most recently served as director of USAID's mission in Nepal and has also served in Ethiopia, Afghanistan, and a number of roles in Washington. And without objection, your full resume will be made a part of the record, and please proceed as you would like.
Thank you. Good afternoon, Chairman Smith, Ranking Member Bass, members of the subcommittee. Thank you for inviting me to speak today, and thanks to all of you for your continued support and leadership on nutrition and food security. I also want to thank Mr. Makande for that presentation. We're grateful for the FAO's close collaboration with Feed the Future, and it is wonderful to hear Mr. Makande reaffirm just how seriously the FAO takes nutrition. In particular, I'd like to express my gratitude to you, Chairman Smith, for introducing the Global Food Security Act, which shows the U.S. government's strong bipartisan commitment to reducing global hunger, poverty, and malnutrition. The Global Food Security Act has passed both the House and the Senate, and we are looking forward to working with the subcommittee members and Congress to pass it into law. And as Feed the Future's Deputy Coordinator for Development, I'm honored to be able to talk to you today about the important role the U.S. government is playing in the fight against global hunger, poverty, malnutrition, particularly due to the 1,000-day window between pregnancy and a child's second birthday, when good nutrition matters the most. Nutrition bridges many areas. It affects human health, development, economic growth, agriculture, education, and resilience. And because of this, Feed the Future has taken a comprehensive approach to undernutrition. And this approach has contributed to substantial progress on food security and nutrition globally. Farm productivity is on the rise among much of the global South. Poverty rates and hunger have fallen dramatically in many of the countries where we work. Growth rates in agriculture are among the highest in recent history, and preliminary data demonstrate that we are on track to see poverty and stunting reduced by an average of 20% across the areas where Feed the Future works by 2017. Just one example from this is Cambodia, where from 2010 to 2015, the prevalence of stunting fell by 23.3% across the areas where Feed the Future focuses its efforts. And while we have seen impressive gains over the past 5 years, particularly on stunting and nutrition, there is still much more to be done. We know that 795 million people are still undernourished globally, and that is 795 million too many. Undernutrition, particularly early in life, impairs cognitive, socio-emotional, and also motor development. It leads to lower levels of educational attainment, productivity, and lifetime earnings, and ultimately, it slows economic growth. For example, we know that by reducing stunting by just 20%, it can lead to an 11% increase in incomes. Yet we also know that relatively simple interventions, such as increased consumption of vitamin-rich orange flesh sweet potatoes, can have a transformative impact on people's lives, especially children's. Our interventions in nutrition are a smart investment in building human capital and shared prosperity. Every dollar spent on improved nutrition yields up to $18 in returns. But to accelerate progress on poverty and hunger and to ensure robust, inclusive economic growth for years to come, we must do more to end malnutrition. Significant reductions in stunting take time, but given the solid collective results over the past decade and the global community's commitment to solving these issues, I am optimistic that we can work together across sectors, across disciplines, and we will see the elimination of malnutrition. And while it's clear that Feed the Future can and has done a lot, we know that we will never be able to eradicate global hunger, poverty, and undernutrition on our own. To succeed, we have to have additional partners committed to transforming agri-food systems so we can deliver benefits like good nutrition for years to come. But impact like this does take funding, and to pay for it all, we must develop a new international framework for financing agriculture, food security, and nutrition, one that goes beyond donor assistance to better leverage resources from all sectors. So going forward, the Feed the Future will intensify our partnerships, and we have been intensifying our partnerships with developing country governments to expand ownership and create environments that allow our investments to take root, multiply, and thrive. The private sector to bring market access, cutting-edge business practices, and innovative insights to the development table. And financial institutions to spur greater investment in small and medium enterprises and smallholder farms, ensuring inclusive, sustainable economic growth on a macro level. And civil society is also important. They help to amplify our message, increase transparency, and make certain that vulnerable groups are protected and our investments reach our targeted population. By bringing partners together to focus efforts on agriculture and nutrition, Feed the Future and the U.S. government have achieved a great deal. Our approach is working, and we can and will leverage it to do much more. And that's why Feed the Future will continue to forge new partnerships and strategically steward our resources to multiply our impact and build a more food and nutrition secure future. One of the most important partners we have in this is the United States Congress, and I want to thank you again for your leadership on this issue. I am grateful for the opportunity to speak with you today, and I welcome any questions, comments, and suggestions you might have.
Thank you very much for your excellent testimony. Without objection, your full, very extensive commentary will be made a part of the record. And just a few opening questions, and I'll yield to Ms. Bass and to my good friend, Mr. Clausen, and then maybe have some follow-up questions at the end. You pointed some excellent results in Cambodia, Honduras, Bangladesh, for example. I know when we spoke privately, you talked about what was going on in Nepal,
Right.
Which you might want to elaborate even further on, particularly that way of, I know it's not a food security issue, but that great birthing technique that you were beginning to elaborate on when we last met, particularly with regards to the umbilical cord, which saves lives. But Nigeria is one of the worst when it comes to the loss of child's lives, both neonates, newborns, and unborn children. And I'm wondering if the new government has been responsive to initiatives. Of course, they're challenged with Boko Haram. We all know that. And those children in the 3 northern states particularly are probably even more malaffected than anyone else. But if you could speak to some of the other African nations, but particularly Nigeria.
Great. So I wanted to highlight, as you mentioned, chlorhexidine, which is an important intervention where it was based on years of research that USAID funded in a partnership with in Nepal, and in partnership with a local private sector company that we also helped to support. The government really took on this initiative. It's a gel that you put on the umbilical cord after birth to keep the umbilical cord sanitary to prevent against tetanus. And as we know, as child mortality rates are decreasing, neonatal mortality rates are often the most difficult to really start seeing great movement on. And this really helps, can reduce the infant mortality rate by 23% just by use of this one gel. It costs pennies to distribute, and in Nepal, we're working to have it disseminated across the country. A network of 48,000 community health volunteers have taken up this effort under government leadership and are working to get it out to the farthest reaches of way up in the mountains, way out into the plains. It's very easy to apply. It's something that these community health volunteers, when they work with pregnant women to inform them of best practices going forward to have a healthy pregnancy, it's something they can give to the women. And there's one person who's always present at a delivery, and it's the mother. So the mother carries the packet around with her, and she's able. It's just a one application that anyone can do. So that's a very, very important interventions. And I do know that governments of Nigeria have gone to Nepal to receive training and to better understand how chlorhexidine works and how they might integrate it into their health system. How far it's actually gone, I'm not sure, but it's one of several governments that have learned from Nepal in this effort. And we are looking at working with, the African Union has shown tremendous leadership on the issue of food security and nutrition, and are really working to highlight what we're calling champions of change, to work with partner country governments that are demonstrating the type of leadership by putting their own funds into agriculture and food security by putting in place the right policies that can really allow space for private sector investment to further fuel the agricultural transformation, to fuel investments in nutrition. And by elevating those leaders that are doing a good job, they're really incentivizing others to follow suit. And we're hopeful that Nigeria will go along that path as well.
Let me ask you, you mentioned the importance of faith-based and private sector. Are you finding, a lot of buy-in from the faith-based community when it comes to these initiatives? Are they included in a robust way by the governments? I know our own seeks and reaches out, but are the other governments doing it as well, particularly in the 19 countries where we're involved? And secondly, if I could just ask you with regards to the post-2015 SDGs and, of course, the decade of nutrition. I'm always concerned when there's so many aspirational goals, targets, indicators, and the three-pronged approach with the post-2015, that there's so much, people then don't prioritize and do as much as they could, particularly on such a life-changing and life-enhancing initiative like Feed the Future. To ensure that we don't get lost in other good things, but they get crowded out by trying to do it all. Your thoughts on how we can keep this prioritized going forward between now and 2025 with the decade, and also 2030 with the post-2015?
Thank you, Chairman, for those important questions. I wanted to touch first upon faith-based organizations, which are incredibly important to Feed the Future and the implementation. As we work with civil society, faith-based organizations are a critical part of that throughout all of the 19 focus countries where we work on many, many different levels. Just to provide one example, in Zambia, Catholic Relief Services is really out there working specifically to deliver nutrition messages to 1,000-day mothers, and also to 1,000-day mothers in their communities, really helping them to understand what types of nutrition they need to ensure that they have, they really take advantage of this really critical window, and also making sure they have access to those nutritious foods as well. Let's see, I wanted to talk also, about the SDGs. And I think you're right, the SDGs it's a very important global moment where world leaders came together to really agree how important development is and really codify that. As we know, SDG 2 is most focused on hunger. We think it's a really important way to elevate the work that we all think is so important. There are a lot of competing priorities out there. I like to say that hunger and food security really weaves itself through all of the SDGs and is really central to everything that we can and will do. I think in order to really help us raise the profile of this effort, I think are the results that we're starting to see come in. With the right types of investment, we can see change, and I think that is as motivating a factor as anything to really keep this top of the policy agenda.
Okay, thank you. Ms. Bass.
Thank you very much for your presentation. You know, in many ways, we're talking about a difficult subject, but in many ways, you're filled with a lot of good news, too, in terms of, practices that are really making a difference. And I wanted you to expand on that.
Yep.
So a few things. In terms of Feed the Future, I've traveled to a couple of countries and have seen Feed the Future in action, specifically, though, as it relates to farming. In your written testimony, you have a couple of examples that I wanted you to elaborate on. One was chicken choice in Kenya. And so I wanted to know if you could give a couple of examples of Feed the Future's best practices that weren't very specifically agricultural.
Thank you, Ranking Member Bass, for that question, and also for your support, the Global Food Security Act. Chicken choice is one of my favorite examples, which I think is why it made it into the written testimony. It's a really nice example of someone who worked in a chicken factory who saw that chicken parts were being sort of discarded, and these were poor women who had no other choice, no other avenues, were coming to sort of dig through the trash to find these parts in order to have something to feed their children that was nutritious. And so he started a product made from these byproducts and started expanding to different locations without Kenya. Ended up with 9 locations, but had difficulty reliably transporting this very nutritious but low-cost product to these 9 locations. And we helped him buy a refrigerated truck, as simple as that. Given that transport can be dicey, this really helped him expand his business and get this low-cost, nutritious food out to many more people. So I'm glad you like that example. That's the type of sort of ingenuity and innovation that we really need to see from the private sector that we're trying to support. Other examples, just to put out there, I was just in Rwanda last month, and I went with a group of women to their field of beans. And they have been growing iron-fortified beans. This bean has double the yield as a traditional bean. It cooks in half the time, which is very significant for people who are time-bound and also really needing to get fuel to cook all their food with, and has a very important source of iron. And so I think these seeds were starting to disseminate throughout Rwanda, and I think will be very much game-changing when one of these staple foods becomes something that is iron-fortified from the very beginning. So there's a couple of examples. I'm happy to provide more as well.
Great, I appreciate that. I wanted to know some other input around Africa. You talked about how the African Union was really taking a leadership role, and maybe you could be specific about that, what you mean. And then in that regards, also, I wanted to know if you feel that there are examples of roles being played by the African regional economic communities regarding a more regional approach, especially with some of the smaller countries.
Yeah. So the African Union is the Malabo commitments that came out of their 2014 summit are very, very good if you read them. And I think the African Union is looking to see how can we use CAADP to sort of fuel the implementation or the attainment of these goals, which include things like reducing stunting, poverty, tripling trade, and the rest. And they're launching this campaign called Seize the Moment, talking of champions of change, like I said, really elevating country leaders who are doing the right thing on agriculture and malnutrition. And so we're really looking forward to seeing how that campaign goes to really elevate this issue, as Chairman Smith said. On the regional issue, I think the regional economic communities play a very, very important role. I'll take the example of Senegal, and then I've also got an example of Togo I can give. Senegal, the regional economic body in West Africa, passed standard certifications of seed, but these were not adopted by Senegal for many, many years. So what you found were that private sector actors involved in seed production multiplication were not able to operate freely in Senegal, and the government was left with an inadequate system really trying to get seeds out to farmers and didn't really have access to the latest seeds. So the government of Senegal, as part of its new alliance commitments, in 2013 passed a law that put Senegal in line with these regulations that have been passed and encouraged by the regional economic community, and therefore really allowed for private sector engagement in the seed sector. We helped to amplify this effort once the policy was right to get private sector actors really out there producing, multiplying seeds that were able to reach many, many more farmers. As a result, Nareka rice now is readily available on the market. It's a rice that's drought resistant, drought tolerant, and also increases yield by up to 3%. And so as part of our interventions working with private sector and this important policy change, now 180,000 farmers have access to this new technology that's really game-changing. Also, the regional economic community put in place some regulations on how many border checkpoints you could have, a minimum of 3 border checkpoints, which is critically important. And we supported some businessmen in Togo who really went to the ministers and said, wait a minute, you guys aren't applying, you aren't abiding by this regional economic rule, and had an advocacy campaign to get people out to see all of the checkpoints. And upon really understanding what it took to get food from the north of Ghana down to the southern Ghana, in Togo, which was taking up to 4 days, they were aghast and put in place these changes, and now it only takes 1 day to go from the north
Wow, that's great.
So-
That's wonderful, because that's a problem really throughout the continent, is how to
Absolutely.
do the trade intracontinent. So one question that always comes up in my district whenever I talk about Feed the Future, and I brag about the Feed the Future all the time, but I'm always questioned as to whether or not GMOs is a real big factor. Like when you were describing the beans and then also the rice, and so I wanted to know if you could comment on that.
So I think that genetically engineered technology is one of many, many tools that we use, along with conventional breeding, along with other techniques to help farmers increase their productivity that have to do with things like drip irrigation and the rest. We definitely follow countries' own laws, regulations, and wishes around genetically modified crops.
Thank you. Thank you very much.
Mr. Chair.
Thank you for coming. Thank you for your important work.
Thank you.
My firsthand experience tells me that for subsistence farmers to make meaningful progress, A, they have to have diversification, which you have spoken to, and B, they have to have credit.
Right.
Now, we've been talking about microcredit since I was in college, and you know I got a lot of gray hair right now. And so I hear and read and see with my own eyes lots of really good programs, small programs in Southeast Asia and Africa, wherever. But given the level of corruption for a lot or most of these governments, depending on how charitable we want to be, I don't know of any examples of countries that are struggling with hunger that also have widespread microcredit available for a private market of struggling subsistence farmers. And without that, all of this is just anecdotal talk to me.
Yep.
I'm glad you're doing what you're doing, but if there's no microcredit in Africa or Southeast Asia at a broad level, because there's so much corruption and there's not a developed private market for it, we're just blowing in the wind as far as I can tell. Am I wrong about what I'm saying? Or I'd like you to tell me I'm wrong and there's XYZ country that is struggling to make the jump and that has large non-corrupt microcredit market for people that need it. Does that exist in the world?
So, Mr. Clausen, thank you so much for your question. And also, before I go on, I also want to thank you for your support of the Global Food Security Act. I think you hit on one of the key issues. It's, as I said, all of this takes money, and money at different levels to invest in public sector infrastructure and research, but really to invest so that the smallholder, small and medium enterprises can really move the agricultural system to have the kind of outcomes that we're looking for. So I think you are right. Credit is one of the critical components to enable us to reach our goals. I just wanted to provide another example from Senegal where, I mean, one of the problems with really getting agricultural credit out there is that often you need a little bit bigger loans. The payback time needs to be a little bit longer sometimes because you have to wait for crop cycles. And frankly, it's a very risky investment for commercial lenders. And so how do we get money out to these people? And I think that there have been some very creative ways over the years. One thing that we found in Senegal was to really look at how can we work with banks to have a more creative means of collateral. One thing that we did with working with farmers in Senegal is that we basically took out iPads and found, you know, one or two people in the communities who actually were computer literate who could start recording production data from all of these farmers. And really, after they build out a couple years of production data, to be able to take that information to banks to say, look, here's a record. It's not so risky to lend money to this farmer so he can purchase the inputs he needs to have a good harvest, because here's his production record, and that will give, that's some guarantee. We also found in Uganda, where 5 youth who met at a Feed the Future innovation conference in Uganda came together and started a mobile app company that provides, it also provides information to farmers on best practices. But what it really also does is these agents are then able to go out to farmers, collect information, and create a credit profile for these farmers who are often illiterate and take it to banks to be able to get them to be able to loan money to farmers. So I think finding creative ways to really get these funds out to farmer is critical.
And what country actually has a functioning microcredit market for these kind of folks? Does that exist? I mean, I love what you're telling me, but does that exist?
So I think you're right.
I'm not saying that it doesn't exist. I'm asking you,
So
is there anywhere in Southeast Asia or Africa of a developing country that has a microcredit market that actually give poor people an opportunity to expand their crops
So I think
without paying 20% a month?
I think that if you saw a system that worked very, very well, you would see great reductions in poverty and hunger. The countries where we work, there are instances of credit being available, but we have not yet succeeded in making this something that's universal across the country. So I think you've hit on one of the key obstacles that we're tackling moving forward.
In your testimony, Dr. Dunford, you talk about the 11 different federal agencies for the whole of government initiative, and of course that language is reflected in our bill, both the Senate and the House bill. And the list includes, of course, the Office of the United States Trade Representative. I'm wondering, there are agencies that are all in and doing more just because of what their past has been, especially your leadership. How helpful has that Office of Trade Representative been? I know that, I've been in arguments with them over TPP and other issues. I think you have too. But it seems to me that this is a golden opportunity to, just like the World Bank has done such extraordinary humanitarian work on a number of areas, and most people, when they think World Bank, don't automatically think of that. So if you could maybe...
I think thank you very much for this question. I think that working with USTR has been an incredible important partner for us. Really expanding trade is one of the most important things. Trade, not aid, is really going to lead to the future that we seek of a food secure world. And so we've been partnering with USTR to build the capacity for Africans to increase their trade. We've also been working in other areas as well. So I think they're an incredibly important partner, mostly in the capacity building of key trade systems, and will continue to be moving forward.
Can I ask you, how well coordinated is the effort to ensure that folic acid is included? As I think I know, and I might have conveyed this to you when we met, I wrote 3 laws on combating autism, including the Combating Autism Act. The Autism Cares Act just became law. And the NIH research, the most recent compilation of their research, suggests 3 studies that say the children on the spectrum can be reduced by 39 to 40% with 400 micrograms of folic acid per day, as long as it's 3 months before actual conception and no later than a month or 2 after conception. After that, it's helpful but not determinative. And it also reduces spina bifida and other neurological problems. I'm wondering, how well can you coordinate that to ensure that that's part of the package? Because just one last thing, in the year 2000, I was with Greg Simpkins, my chief of staff for the subcommittee, in Lagos, and I gave a speech on human trafficking. And a man came up and said, well, what are you doing about autism in Nigeria? I said, nothing. We had dinner that night, and it was a learning experience for me to find out how much unmet need there is in Nigeria and the rest of Africa. The WHO has said there's tens of millions of autistic children in Africa, largely underreported and not getting anything like early intervention. But folic acid could be not a panacea, but part of a solution. And I'm wondering how well that's integrated.
So I think our efforts are really focusing on helping people to grow and access the right types of food in order to have a balanced diet that would include all of the types of micronutrients that you're talking about, including folic acid. And I know our colleagues in global health work also in micronutrients, and I'll check with them and get back to you in a written answer on how we include folic acid specifically.
For the record, how much are we spending on Feed the Future in fiscal year 2016?
895 million.
Okay. And let me think, is there any other questions? Unfortunately, we're being called over for a vote.
Yes, of course.
And I apologize for that.
That's okay.
We're planning a meeting, and I would hope you and Mr. Markanday, if you would consider this as well. We're going to invite the ambassadors from Africa and other countries, particularly developing countries, to a forum on Feed the Future. We're hoping that Roger Thoreau, we've asked him already, and he seemed very interested to come and speak about that all-important first 1,000 days. But of course, what follows is important as well.
Right.
But it would be a great opportunity for all of us to encourage the ambassadors to be in contact with the home front and the Home Office and the Health Minister to say, okay, we've all signed up, scaling up, but what are we really doing? Are we really making this a priority? Because the intentions are great in many capitals, but competing challenges sometimes crowd out this highly efficacious effort to help women and children. So if you would at least consider being part of that panel, it would be very, very helpful.
Absolutely, I would be honored.
As soon as we get a date, we'll get to you. We're trying to find out when the African ambassadors especially would be most available, but we want the other ambassadors to be there as well. I was actually in Guatemala the day they signed up with us to work on the first 1,000 days. And I met with the speaker that day, and he was all in and very excited about what it would do for stunting in Guatemala. So is there anything else you would like to add? And I have more questions, but we are almost out of time because of the vote.
Well, I just want to thank you so much. It's been an honor to be able to testify before you and your committee today. I really appreciate your interest and support in this effort. I wanted to just give one more example, really talking about the importance of women in Feed the Future and sort of the groundbreaking work of the Women's Empowerment and Agriculture Index that has really helped us for the first time really measure women's empowerment and understand where and why empowerment goes up and down. This is an area where Bangladesh, when we did the first round of WIA, scored lowest of all of our focus countries on this index. And it really led our mission and also the country of Bangladesh to really take this seriously and say, what can we do to increase women's empowerment? And found that public speaking was one of the key issues and really worked to ensure that women had opportunities to be trainers as in agricultural extension, and also looking at that they had problems with control over their production, and really understanding that actually fishing was one of the biggest smallholder activities, and that the big nets being used were so big that men had to actually harvest the fish, which led women to be dependent on men to harvest the fish for their own consumption and also for sale. And so we've worked to develop a smaller net that more women can use so they can then control the efforts of their production. So you're seeing a big improvement in women's empowerment in Bangladesh, and it's just showing how measurement combined with government leadership and our efforts can really quickly move the dial on an issue that has been so pervasive for decades.
My colleague, Mr. Clausen, raised some, I think, interesting points about microcredit lending.
Right.
I've actually authored 2 laws on microcredit lending, and the biggest takeaway I had about all of that was how well women were able to take modest amounts of money and, almost like the loaves and fishes, multiplied the effect, fed not only their families, but hired people, paid back the loan so that the revolving funds were back into the kitty to help other people. But I'm wondering, maybe as a question, do you find that there is a good interface between Feed the Future initiatives, private sector, NGOs, FAO, of course, and yourselves, and the micro-lending initiatives as well?
Absolutely. That's one of the things we're really trying to do. I think Mr. Clausen hit on a key issue it's a hard nut to crack, and we're really working towards getting there. So yes, that is well coordinated. If I could say put one more point on the table, I started out my career in international development at USAID as a young officer in Ethiopia back in 2002, 2003, where there was a famine, 14 million people on the verge of starvation. It was my first experience with anything like this, very, very formative. That year, I was working on providing food assistance to these people. The USAID mission in Ethiopia that year spent $5 million on agricultural development and nutrition, the type of work we're talking about today, and spent $500 million on handing out food to people. And while that's a very, very important effort, I just really applaud your support for us to actually reverse that, to spend more money actually on building the long-term capacity is going to help people pull themselves out of poverty and pull themselves out of hunger. Really appreciate your efforts.
Okay. But again, we appreciate your efforts, because you guys are walking point and doing a tremendous job. Thank you for your personal leadership, expertise, and determination. The hearing's adjourned.